Okay, part two. So screen. Okay, so here are all the arteries I talked about. Okay, so you can skip the inferior phrenic arteries. They don't do very much anyway. But here, this big thing right here is the celiac trunk. Okay, you see it come out here. This side goes to the liver. This side goes to the spleen, and that middle one actually goes to the stomach. Okay, but celiac trunk. Don't worry, you're not responsible for the branches of the celiac trunk. Okay, this right here is a superior mesenteric, and that right there is an inferior mesenteric. And we'll show you what it does before coming back to this picture. Okay, so this is the celiac trunk. Okay, this is the inferior mesenteric, and inferior mesenteric, superior mesenteric. So it goes to this white sheet there. That white sheet is called a mesentery, and it surrounds your intestines. The blood actually goes to your intestines. Okay? All right, now the other ones, okay, the paired ones. The first pair goes to the suprarenal, okay, so it goes to the adrenal glands. They can also be called the suprarenal glands. Okay, because supra and ad actually mean the same thing, and renal means kidney. Okay, so here are the renal arteries. They go to the kidneys. See how much bigger they are? The renal arteries are ginormous because when you're resting, about 20% of your blood volume goes to filtering. Okay, and then lastly, this little thing is the inferior mesenteric. Okay. Okay. Now, the end of the aorta is at L4. Okay, that is the level of the iliac crest. Therefore, the split is called the common iliac arteries. Okay, so you have a left and right common iliac arteries. The common iliac arteries, so you see the common iliac arteries will immediately split. Okay, so common means that it will split. Okay, common carotid splits into internal and external. Common iliac splits into internal and external iliac. Okay. Okay, so the common iliac splits into the external and internal iliac. The internal is much smaller and stays inside the groin region. The external is much larger and it passes here and turns into the femoral artery. Okay, so here's the internal and here's the external iliac. Okay. 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 So here we have this big artery here, the femoral. Okay. The femoral then goes down. Okay. It goes deep. It starts off really, really superficial. Near the groin, the femoral artery is really, really superficial, and you can really kind of easily stab into it and bleed out, actually. Okay. And then it comes down, it goes deeper, and comes out the back of the knee as the popliteal. Okay. From the popliteal, it goes down a little bit further and turns into the popliteal back of the knee. So it turns into the posterior tibial. Okay, the posterior tibial has an anterior branch that is sent forward called the anterior tibial. Okay. Okay. And then show you how that goes. Okay. So you see the posterior tibial here. Okay. The posterior tibial then splits, okay, into the plantar arteries, so the medial plantar and lateral plantar, and they form the plantar arch. Okay, the plantar arch is the same as the palmar arch, right? So, and then they have the digitals coming off of that. Okay. Okay. So those are the arteries that I want you guys to know. So again, everything on that list is, fair game. Okay. Okay. The three major veins enter the right atrium. You should definitely know what those are. Okay. Again, superior cava, inferior cava, coronary sinus. Okay. All medium and large arteries have deep locations that are accompanied by deep veins. Okay, first of all, our arteries are much deeper than our veins. Okay, and they're under higher pressure and they hurt more. So if you damage an artery, it actually hurts tremendously, as opposed to poking a vein. Okay, so all medium and large arteries have locations that are accompanied by deep veins. Okay. Okay. The multi-vein bundle of venous packages. Okay, so you don't have to know the dural sinuses. You do have to know the hepatic portal system. We were talking about two vena cavas already, superior vena cava, inferior vena cava. Okay, so when you're coming back from one of the limbs, the arms always go up above. So always the last thing to enter the heart is the superior vena cava. The legs, they come from below, so they always go from the inferior vena cava. Okay? The last one is the coronary sinus, which drains the heart itself. Okay? Okay, the dural sinuses. Okay, so the dura, okay, actually contains the large blood vessels in the brain. But since, like, your head is above your heart, your blood vessels, they don't need to do very much other than act as a drain. Okay, so they work as sinuses. Sinuses are like drains. The blood just kind of drains down into that hole here. Okay. All right. The veins in the neck, you do have to know. There's two big ones, right? The internal jugulars and the external jugulars. Okay. The internal jugulars drain the blood from the brain. Okay. The external jugulars drain the blood from the scalp. Okay. Just like the external carotid drains the blood from the scalp, and the internal carotid drains the blood from the brain, or supplies the blood to the brain. The internal jugulars match up with the internal carotids. The external jugulars match up with the external carotid. It's not a perfect match, but close enough for you guys. Okay. Okay. So here you can see this is the external jugular. This is the internal jugular. Okay. I'm sure you guys have heard the term like going for the jugular. It's what lions do actually, and they actually are. They're trying to sever this thing right here. Okay. 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 Now the arm. Okay. So if you look at my list, most of what I ask you to do is pretty straightforward. Every blood vessel, every artery has a matching vein. So the radial artery has a radial vein. The ulnar artery has an ulnar vein. The palmar arch has a palmar arch vein, or palmar venous arch. They mean the same thing. The digital arteries have digital veins. Okay, everything's all the same. There's one exception to that rule, and that I'm gonna make sure you guys understand. So it will definitely be on the test, and that is this one right here. It's the one that crosses the elbow at the middle. So median cubital vein. And the reason why you guys all need to know this is because that is the vein they inject shit into or they draw blood out of when they're trying to, take blood out of you. Okay? Take blood or IV fluid, phlebotomy, anything. I mean, that's the easiest access. Okay? Okay. The superficial veins and that's most frequently, so they crisscross and stuff like that. And so not everyone's has the exact same pattern and stuff. So it's okay. The veins of the abdomen, again, this is pretty straightforward. These are the renals, right? They match the renal arteries. The internal, external iliacs match the internal iliac veins. Okay, this here is the inferior vena cava. Okay. Okay. One important thing I want you guys to understand is the hepatic portal system. So this will also be on the test somewhere. Okay. One of the things that you need to do with the blood supply is absorb nutrients in the intestines. Okay? But you don't eat just food and you don't eat just nutrients. What you eat is a lot of nutrients and a lot of shit that you shouldn't have in your body. Okay? There's some toxins and waste products that you need to get rid of before that stuff gets into your entire body. Okay? So, what happens is you have something called a portal system. Okay, so remember the standard is artery, capillary, vein. A portal system is artery, capillary, vein, capillary, vein. Okay, so I have a vein. The vein branches into a second capillary system, and then the second capillary system goes into another vein. Okay, so here, the first one is arterial blood. The first capillary bed is in the stomach and intestines. I pick up all the nutrients and toxins that I ate, and now it goes into my bloodstream. But it stays in the veins here. The veins, all of them. So all the things that drain from your stomach and your intestines, they drain together into this big tube called the hepatic portal vein. The hepatic portal vein goes to the liver, okay? And then the liver detoxifies everything, okay? And then from the liver, they go into the hepatic vein, okay? And then after it goes to the hepatic vein, that means it's been cleaned by the liver already. So now the food is clean and I can send it everywhere I need it to go. So I go from the hepatic vein to the inferior vena cava, and from the inferior vena cava, it goes to my heart, and once my heart pumps, it sends it everywhere. Okay? So this is a protection mechanism. It cleans, this portal allows the liver to clean all the toxins before you actually absorb it. So one of the best places to look for poisoning is the liver. So if you're alcoholic, the first thing that goes wrong, right, is your liver, because um, the stomach absorbs alcohol and then goes through here into the liver. Okay. So you see, like all these stuff, okay, all these veins from the spleen, from the gastric veins, from the inferior mesenteric, superior mesenteric veins, they all drain into the hepatic portal vein here into the liver. Okay, let me finish this. So make sure you guys understand this. Okay. Blah, blah. Okay. Now, again, the veins of the legs are the same as the arteries. Again, there's one big exception, and this is this one right here, the great saphenous vein. Okay. The great saphenous vein is important because it's so not important, actually. It's ironic. So it's not important to the circulation of the leg. It's big and it's huge, so and it's superficial, so it can be easily cut out. And so the reason why this is important is if I wanted a tube to do a coronary artery bypass, this is the tube I take. Because one, okay, first of all, you can't take arteries because arteries are usually critical. You only have one artery to a certain location, most locations, and you can't remove that. Two, veins are bigger and veins are more superficial, so it's easy to cut out. Okay, so you can cut this, and most veins last the most. So if you cut out one, it will just find another way around. Okay, so you cut out this tube and you use it for what's called a cabbage procedure. Okay, coronary artery bypass graft. Okay, so medical relevance. Okay, and then the back of the leg is exactly the same. Okay, you have the posterior tibial, you have the plantar veins here, you have the plantar arch. Okay, and the digital veins. Okay. All right, this is a aneurysm, so you can see the swelling of the aorta right there, and the plaques that are causing the swelling of the aorta right there. Okay. Fetal. Okay. The other disorder I want to cover is this microangiography of diabetes. Okay, diabetes is high blood sugar. Blood sugar is sticky. Okay, so sugar is sticky. So the higher the blood sugar, the stickier your blood is. And the stickier it is, the more viscous it is, the harder it is to flow. And the small little tubes, okay, the small little capillaries, the smallest ones are actually in your eyes. Okay, and those are the ones that get clogged by diabetes. Okay, and that causes, amongst other things, blindness. Okay. All right, so fetal circulation. Okay, so I just want to explain why fetal circulation is a little different. Okay, because honestly, this is fetal circulation. Okay, the high oxygenated blood comes from the mother, not your lungs. So it's actually coming through the inferior vena cava here. Okay, so now if I go for inferior vena cava, I'm going to the right atrium first. But the right atrium goes to the lungs and come back. That's a waste of effort. Okay, so what I do is I have a shunt. I have two shunts. Okay, I have one shunt here. Okay, that is a foraminal valley. Okay, so I can go directly from right atrium to left atrium, and then from left atrium through the body. Okay, the other one is up here, the ductus arteriosus, where I divert blood from the pulmonary trunk into the aorta. Okay? All right. So that being said, as soon as you're born, those two things have to change. Okay? Three things. You have to get rid of the umbilical arteries. Okay? So that seals off and becomes the round ligament of the liver. Okay? That seals off and becomes the foramen ovalis. Okay? The ductus, the tube right there becomes the ductus that closes, the ductus arteriosus closes, it becomes the ligamentum articulosum. Okay, so these three changes are critical to fetal circulation, or changing from fetal to adult circulation. Okay. All right. Okay. Okay. Hope that makes sense. And stop recording.